Hey, this is Dr. David, Sharon David. I am here from Fort Wayne, Indiana. I am a physiatrist, and I have Marina Castellanos here. She is a physical therapist who specializes in pelvic floor disorders. We just wanted to come talk to you guys. I've got a lot of questions on my post on pelvic floor disorders and pain, and so wanted to follow that up with just a video question and answer. And Marina, do you want to introduce yourself a little bit?
Absolutely. Thank you so much for inviting me to do this video with you. So I'm a pelvic floor physical therapist. I specialize in the treatment of women and children and teenagers. I work out of Westchester County, New York, and been a PT for about 20 years and really been focusing on pelvic health for the last 5 years.
Awesome. Well, thank you so much for taking time out on your Saturday. I know it's a gorgeous day out here, so I do appreciate it.
Yeah, it is.
So one of the things I just wanted to ask is what you're seeing, what women just come to you for? What are some of their common concerns, complaints?
Okay, so, women can come in for a multitude of reasons, whether, they're pregnant, postpartum, even women who haven't had children can still have pelvic floor dysfunction, and we're just talking about adult women right now. But I would say the main reason most postpartum women come in to see me is stress urinary incontinence, which means that they're experiencing some urinary leakage when they exercise, when they sneeze, they cough, or when they laugh. So basically, when there's some kind of force or excessive force going on in the body and through the abdomen into the pelvic floor is not strong enough to withstand that force, and then the leakage occurs.
So something I found was very shocking to me was that women aren't talking about these things to their doctors. They're trying to deal with this on their own. And by the time they actually say something, it's been so long or gotten so bad. Do you find that too? Do you find that women come to you early on, or is it more later in the process?
Yeah, it's so true. Women are so reluctant to discuss this with anybody. It tends to be kind of a taboo topic. But really, it's very common. It's not normal to experience urinary leakage, but it is a common finding after women have children. So I'd say women who come to see me, maybe a few months or a year after they have babies,
Wow.
and women who come in, decades afterwards that they started experiencing leakage. And of course, it just never went away because they didn't have the care, after having children that they would have needed to address the leakage. And, these things get put on the back burner. You become a mother and life becomes taking care of your baby and your family. And a lot of our needs get pushed to the wayside. And this just happens. And then before you know it, say, okay, my urination is kind of increasing and my leakage is getting worse. And, it's finally time to, talk to somebody about this. So it's pretty common.
So what are just some things that you typically ask your patients to help them identify that this is something that is a problem? What's normal? What's not normal?
So any kind of urinary leakage is not normal. So if you've had a baby and you've had leakage that persisted after, say, 3 months, then there's an increased likelihood it's going to persist to a year. And then after a year, there's an increased likelihood it's going to persist after that. So really, if you have it in the first 6 weeks, we say it's okay. And then if it's persisting after those first few months, you definitely want to get it checked out. And really what I tell women is after they have babies, they should get checked out after they have clearance from their OBGYN just to assess the status of the pelvic floor, because nobody does that. Your OBGYN or a midwife, they'll check you for certain things like you're healed and that you're medically stable, but they don't check you necessarily for the things that a pelvic floor physical therapist would check you for.
So is that something they should ask their doctor for, to see a physical therapist for this, or?
They can, but in most states now, we have direct access. So a woman can come and see me just on her own, without a doctor's prescription initially. Yeah. So of course, when there's extenuating circumstances, we always keep in touch with the physicians and, we want to work as a team. But if a woman initiates it on her own, she doesn't absolutely have to have the doctor prescription, before going to see a pelvic PT.
So what are some of the first things you do on your first initial evaluation?
So I take a really thorough history. I also ask a woman if it's possible to fill out a diary for a couple of days before coming to see me, just to keep track of the leakage,
Mm,
and also some other habits like bowel habits, diet habits. I want to know, is she getting enough nourishment, enough hydration? If you have a young baby at home, those things are really challenging. I want to know how she's sleeping, and just all those lifestyle factors that make a difference. We also want to look at posture, because our posture changes
oh,
during pregnancy. That changes some of the intra-abdominal pressures that are going to push down on our bladder. After having months of a baby in utero pushing down on the bladder, now that baby comes
mm,
out and our posture is kind of remaining the same. So if we're going to move around in that same pregnancy posture, we're still getting pressure down on that bladder. And then of course, if a woman is consensual to it, I'll do an internal exam, which is really gentle. It's just manually with a finger. There's no stirrups, there's no speculum. It's super gentle. So by doing that, I can assess really, the strength of the internal muscles of the pelvic floor, and see if they're symmetrical, if there's any areas of pain or restriction that might be limiting the ability of the pelvic floor muscles to contract. If a woman can bulge down appropriately. So it's not just about being able to contract, it's really about being able to contract, relax, bulge, and kind of have this normal muscle coordination that we have in the other muscle groups of our body.
very cool. Okay. And so, what are some of the things women can do if they're experiencing these things? If, for example, especially with the quarantine, they can't get into a physical therapist's office?
Right. So the first thing I would say not to do is not to limit hydration, not to limit liquid.
Oh,
So
okay.
automatically, I find that some women cut back on their water to cut back on their leakage, but that's a really bad idea. First, because it can pave the way for infection if we're not hydrated enough. And secondly, if the bladder is only partially full, the urine can get really acidic and actually make leakage worse. So
Mm,
we want to always keep that in mind. We want to have enough hydration. And now really most physical therapists, including myself, work via telehealth. So there's so much, we can do, and education we provide, and interventions we can do through telehealth without even being in person with the woman. So
okay.
the fact that many of us are pretty much, stuck at home now because of the
Yeah.
pandemic, it shouldn't discourage anybody from seeking help. There's definitely help out there.
Okay, awesome. Is there anything we can do as women to help prevent this to happen? Like either women who aren't pregnant but thinking about getting pregnant, or once you're pregnant, are there any things you can do?
Right. So we can't help the fact that the baby's going to be pushing down on the bladder and stretching out, the walls of the vagina. That's just going to have to happen. The baby has to grow, and, it's going to make room in there, and it's going to push in her organs, and that's okay. That's just comes along with pregnancy and becoming a mom. But afterwards, if you want to return to exercise, if you want to engage in physical activity, if you want to get back to some of those normal things you were doing before, after you have the go ahead from your physician or midwife, definitely get a session and a consultation with a pelvic floor physical therapist, because then they can guide you in returning to exercise, returning to intimacy. And if you are experiencing some urinary leakage, then they can discuss with you, some things to change in terms of lifestyle modification. And then they can also kind of take you through, how to assess your own strength and how to properly do a Kegel if that's appropriate for you, because most women don't know how to do a Kegel correctly.
Mm,
Yeah, so that came out in a study, a while back, that at least 40% of women, weren't able to do a Kegel appropriately. So really having that, one-to-one education is really important.
awesome. Well, you actually touched on a point I was going to mention, Kegels. What are they? How do you do it? Any tips, especially since it sounds like it can be difficult?
Right. So a Kegel is basically contracting the muscles of the pelvic floor. And I have a model. So this is the female pelvis. So the pelvic floor on the outside That's these layers here. This is our next deeper layer. So really the muscles that surround our urethra over here are the ones, in control of our continence. So working on a Kegel, we want to make sure we can squeeze the muscles around the urethra. We also want to make sure we're squeezing the muscles around the rectum appropriately. We want to make sure we get some nice symmetry and coordination with the right and left sides and the front to the back. Usually what I tell women when it's appropriate to do a Kegel, we want to envision, squeezing from all sides of the pelvis and then lifting up towards the belly button. So, but like I said before, doing a Kegel isn't appropriate for everybody. So if there's some scar tissue that's still healing, or some fascial restriction in there that needs some work, then a Kegel might just aggravate things. So that's where it's important to have the one-on-one assessment. But in general, doing a Kegel is really refers to contracting the muscles of the pelvic floor. But we have so many layers to our pelvic floor. It's not just contracting like one muscle. So it's really working to get all of those muscles of the pelvic floor engaged, lifting them up, and also doing it in coordination with our breathing.
Well, that's wonderful. You just dropped a lot of knowledge on me, so I really appreciate it. I can tell you as a physician, and especially a rehab doctor, we still don't get that much of that exposure to it. So I can imagine patients who aren't physicians, how many questions they may have. So I do genuinely appreciate you taking some time to just answer these, address these topics.
Oh, you're absolutely right. It's so great. And, women really shouldn't be, afraid to ask questions for their doctor. And, these are all things that we should know. Many of us didn't get, education about our own anatomy and what happens after birth. And so you really want to be just equipped with, as much knowledge as possible, especially going into pregnancy, because one comment I hear afterwards is, why didn't anybody tell me this could happen? And I said, I know, but, we're working to change that. So, the more education, we give to our patients, the better.
Well, thank you very, very much. I appreciate your time today.
All right. You're so welcome. I hope we can do it again.